I will go through P&L and cash flow, followed by sales forecasting and market analysis for about 20 minutes. After that, Carl will give a presentation on pitching and presenting. That'd be very interesting. So to get back to where we were just now, before our break, P&L and cash flow. So what's cash flow? So to identify cash flow, to look at cash flow, I look at a company's cash flow statement. And it would tell me where a company's cash is coming from and how it's using it over a very specific time period. It shows me the operating results and what changes are happening on the balance sheet. Note, however, that cash flow does not include items such as depreciation and amortization. And I'll show this to you in a quick example on the next page. So when I look at cash flow, it tells me something very important. It tells me what the short-term viability and liquidity of the company is. Because if a company has no cash, it can't continue to run. You have no money to pay your suppliers, you have no money to pay your customers. So you need cash. And the cash flow statement is the best way to tell me whether a company has that. The cash flow statement also ties together details from the income statement and the balance sheet to give me a good picture of where cash is coming in and out. So moving on to the income statement. The income statement shows me a company's financial performance over a very specific time period. It describes the financial sustainability of a company. So when I look at the income statement, or P&L, as we call it, it would show me the revenue, total expenses, and it will also show me items such as depreciation and amortization, which, as I mentioned, we do not see on the cash flow statement. So just a very quick example of depreciation and how it appears in the income statement versus the cash flow statement. You own a manufacturing firm, you buy a machine for $10,000, you are depreciating it straight line, so equally over 5 years, so that's $2,000 a year. How will it appear on my income statement versus my cash flow statement? So in this table here, in the center of the slide, I show an equal expense over 5 years of $2,000. And the reason I do that is because the machine is going to be useful to me over 5 years. So I should pay for it over 5 years based on my income statement. But when I'm paying for the machine, when I'm paying in cash for the machine, I can't tell the seller that I'm going to pay him or her over 5 years. I need to pay the seller cash today. So cash comes out straight away, $10,000. So the takeaway from this is that now I'm spending cash on day one, so money is flowing out on day one, but allocating this expense over the life of the machine, the useful life of the machine, allows me to recognize the benefits over a period of time. So let's now look at how biotech financials look like, having looked at the P&L and cash flow. Low cost of goods, 2 to 20%. High sales and manufacturing costs, 10 to 20% of revenues. Important thing, you spend money on R&D, you need to get it back. So you need to recoup your early R&D costs. And typically, you have high gross and net margins. And now you have high gross margins because once you recoup your R&D costs, the cost of direct production are quite low. So this gives you your high margins. So and P&Ls, they can come in very different formats. So a P&L, look at this example from Pharma Engine. Look at the layout. It's a very detailed. They have notes. They have different numbers with different items on the P&L. And it's quite short. It's quite short as well. And they show you two years, 2015 and 2014. Now you look at another company, completely different, AstraZeneca. They show you 2 years, but they show you the change over 2 years. They show you more line items. They break it out as well into different categories based on the different columns you have here. So formatting, how a P&L statement looks like, the formatting can differ between companies and across countries as well. And just some quick examples, which I've mentioned. So my cost of sales as a percentage of revenue, 19%, gross margin 81%, R&D 24%, sales goods and administration 45%, and net margin 11%. If you look at all these figures, the denominator is the same. 24708 is all as a percentage of revenues over here, where I'm pointing at now. So just a quick example for you to work through at home. I'm not going to go through this, but I provided the answers, the worked example at the back, so you all can look through this at your own leisure. But moving on to some basic metrics when we do valuation. So gross margin. When I sell something, I also incur cost of production. So the gross margin is essentially the ratio between my revenues and my expenses. Now the next one is NPV, which is net present value, which is the difference between the present value of cash inflows and the present value of cash outflows. And this present value term, which I use here, is what I was talking about in our discussion on discounted cash flow just now. You're discounting the cash flows to their present value. You have all these future cash flows, you discount them to their value as of today, their present value. The break even, which is another metric, the points at which your expenses and your costs versus your revenues are equal. So breaking even means, let's say you're making a loss this year, and you cover your costs, you just cover your costs next year. Now that's your break-even point. Your payback period, which is the time you need to recover your investment, and the IRR, the internal rate of return. So this is quite a difficult concept, but I'll try to explain it. So it is the interest rate. When you run your NPV calculations, it is the interest rate where the NPV of all your cash flows are equal to 0. And typically we use this to evaluate how attractive a project investment is. Now some advanced metrics, maximum exposure and ENPV. So maximum exposure, it's how much am I going to lose over a specific period of time. And it's calculated at some level of confidence, which you yourself can predefine. Now ENPV, expected NPV, is a method to value risky future cash flows. So normally, how you do normal discounted cash flow modeling is that you would just discount your cash inflows and your cash outflows. You add them together to get a net present value. Now, why this method is different is that there is a probability adjustment to it. Each cash flow is multiplied by a probability to give it, each cash flow is multiplied by its estimated probability. So you see from this chart here, from this diagram here, that all the cash flows are multiplied at different probabilities, and you have cumulative probabilities, which results in this last column here. This is then multiplied to a net present value of each cash flow for each different phase to give you your expected NPV. So moving on to forecasting and market analysis. Now, forecasting is a very important concept because if you're sitting down with an investor, they're going to ask you, how much revenues are you going to generate? How much sales do you expect? What pricing do you have in mind for your drug? How many units of your drug are you going to sell? What's your prediction? Where are you going to sell it? So there are a lot of questions that an investor may ask you, and you need to be able to answer them. So when you do sales forecasting, you have two methods: comparative benchmarks. So very similar to comparable multiples, which we looked at just now. You find a drug you find a similar drug. You look at how much it's selling for, and you have a basis for comparison. Now, top-down forecasting is a bit more involved. You look at countries and regions. Where am I going to sell my drug? Am I going to sell it in China, the US, in Singapore, in Taiwan, or maybe across the EU? You look at what the right population is, because you need to target the right population. My drug may only have efficacy in certain patient segments, so I need to target the right population. Prevalence versus incidence, market share and time of entry. So market share, how many competitors are there in the market? How many competing drugs are there? When am I going to launch a drug? If I launch a drug in 5 years, are there other competing drugs in the next 5 years that can take away market share from me? Pricing, how much should I sell my drug for? What are other drugs selling in the market? If, let's say, all my competitors are selling drugs for US $10,000 a year, I can't price my drugs at $1 million a year. It's I would need a very good reason for doing that. Then there's also compliance. Let's say you're prescribed some medication. You need to take it twice a day. But let's say you are lazy, you're forgetful, you're busy. You take it once a day. So compliance, if you fail to comply, you'll be taking less medication over a certain time period. I get to sell you less drugs. So compliance is also another very important thing we look at. So a general setup for how we do sales projections. And let's start from the very top. Population. Think of it as a funnel, and we get smaller and smaller as we go down the funnel. So we have population, yearly population forecast for a country or region. So this could be the country where you intend to sell your drug in. You have incidence, how many patients develop the disease each year. Then you have presenting. So I may have the disease, but I'll need to go and see a medical professional first to get the necessary treatment I need. And when I see someone, I need to be correctly diagnosed. I need to be identified as having the disease. The next one, treated. Once I've been diagnosed, once I've seen a medical professional, I need to be treated. And then after that, if you look at the brown boxes, class share, molecule share, brand share. So class share, percentage of drugs for particular action mechanism. Molecule share, molecules that have efficacy via the action mechanism. And brand share, how much market share am I going to get from my competitors, which I mentioned just now. As you go further down the column here, you have daily costs. How much can I sell my drug for? After that, you have days of treatment per year. How many days do I need to be on the drug on every year? And there's compliance, which I mentioned just now as well. So this is a quick, this is just an example of how we do projections for valetinib, our lead drug. So in this case, this is for gastric cancer. And to take you through it very quickly, we look at gastric cancer patients' incidence percentages. We're targeting stage 2B to 4 patients. So the brown box is the conclusion. This gives us a total stage 2B to 4 patients. Then we're looking at patients with a percentage of patients treated with the drug to give us first-line drug-treated patients. Now we are targeting a very specific subsegment of patients, which is the HER1, HER2 co-express segment. So this gives us the targeted genotype, first-line patients. And then we look at market share. And that gives me the number of patients that will be on valetinib. But that's only the number of patients, volume numbers. So to come to my sales number, I'll need to multiply it by how much am I going to charge them per month, and the number of months they will be on the drug. So just a worked example for you to look at. So in this case, in this example, which I will not go through in great detail, you see that we do forecasts across different countries and different regions. And in the second table below, you will see that the functional flow matches the flow on the previous page. So I've prepared a worked example for you to look through at your own leisure. It's a case study on severe asthma, which is a sub-segment of the asthmatic market. But just to wrap up, before we go into pitching and presentation skills by Carl. So when we look at valuation, it is not a science. It's more of an art. You got to ask yourself many questions. You know, what are the trends? What are the methods I'm going to use? You know, what's my business model? What drugs am I selling? There's no correct answer. You need to be aware of the advantages and disadvantages of the methods you're using and what the current market environment is when you employ these tools. You need to use these tools wisely, not blindly. And on forecasting, always better to be simple rather than complicated. Always have your assumptions documented. If anyone, be ready to defend your assumptions, and always make sure that you're logical and there's a clear logical flow in your thought process.
So we're going to spend about maybe half an hour on the next section, and then at the end we'll have another 15-20 minutes to ask some more questions, whether it be about the sessions that Zhao has just done or about the next session on presentation skills and negotiations. But we wanted to give you something practical. You know, we've given you, gone through a lot of information, a lot of data, telling you how to value drugs, how to do licensing deals, how to look at companies. What we now want to do is add into all of that, well, how do you communicate that to a group of people, to an investor, to a partner, or to anybody else you may be presenting to? So I want to talk about pitching or presenting. Now we're going to look through 3 different areas. First of all, how do you prepare? So before, and this you can apply to any presentation. It doesn't just have to be about valuing your molecule or why you should do a partnering deal. It could be about, a presentation that you're doing, for your next grant proposal or whatever it might be. So what do you do to prepare? What should you be doing immediately before your presentation? And then how do you actually deliver the pitch? And there's a very interesting link of a video which I would encourage you to click on at some point. Actually, could we? It's only 2 minutes. It's like, do we have internet access here? Need to set up. I'll tell you what. Why don't we? If it is a quick. Hankwai. Okay. Hankwai. Tibia kwai. Okay. So we'll get this done. So this is, you should, when you looking at this, there's no one unique way of presenting. There's no one right method. I would encourage you, when you see people presenting, on TV, it could be someone delivering the news, it could be someone, a politician, it could be an actor, whoever it may be. If you see someone good, watch them. Watch what it is that they do that makes them such an effective communicator. I have my personal favorites. One of my favorites is a politician from way back in the UK called Margaret Thatcher. Margaret Thatcher, I don't necessarily agree with her politics, but she was a very good speaker, and she could hold a room just by the way that she presented. People listened to her. The other person that I admire in terms of presentation is the former President Obama. He's a great presenter. Again, whether you agree with his policies or not, he could hold a crowd and people would be listening to his every word. My other favorite one, I don't know if anyone here watches Star Trek. It's like Star Trek The Next Generation is what's the only Star Trek in my mind. So Star Trek Next Generation, Captain Jean-Luc Picard is a great speaker. He also happens to be a British actor, but he's a very, very good speaker. And when you see him, commanding the crew of the Enterprise, how he does it, how people listen to him and are drawn to his voice and his style, you can maybe pick up a few points there as well. Over here.
We decided to do it in. The choice we made was music. Now, why music? Well, we love music, and it's always good to do something you love. More importantly, music's a part of everyone's life. Everyone. Music's been around forever. It will always be around. This is not a speculative market. And because it's a part of everyone's life, it's a very large target market all around the world. It knows no boundaries. But interestingly enough, in this whole new digital music revolution, there is no market leader. There are small companies like Creative and Sonic Blue, and then there's some large companies like Sony that haven't had a hit yet. They haven't found the recipe. No one has really found the recipe yet for digital music. And we think not only can we find the recipe, but we think the Apple brand is going to be fantastic because people trust the Apple brand to get their great digital electronics from. So let's look at portable music. Let's look at the landscape. The first thing, if you want to listen to music portably, you can go out and buy a CD player, right? That's one way to go, about 10 to 15 songs. Or you can buy a flash player. Go out and buy one of those. You can buy a MP3 CD player, or you can buy a hard disk-based jukebox player. These are the 4 choices for portable music right now. So let's take a look at each one of those. A CD player costs about $75, holds 10 to 15 songs on a CD. That's about $5 a song. You can go buy a flash player, pay about double that, about $150, holds the same 10 to 15 songs, or about $10 a song. You can go buy an MP3 CD player, and an MP3 CD, which you can burn on your computer, costs about $150, but holds 150 songs. So you get down to $1 a song. Or you can go buy a hard drive jukebox player.
Okay. I know you'd much prefer to watch Steve Jobs rather than hearing me speak, but we should really get back to the slides. So, a great example from the late Steve Jobs about presenting and delivering a pitch. And, a few things you can pick out, not a huge amount of information being conveyed, but he's really telling you a story. He's really carrying you along and ultimately is going to be selling you this device. So do look at examples of people like Steve Jobs and others, and we're going to pick up on some of the things that Steve Jobs was doing, some of the things that you could be doing as you're presenting and you're pitching. So when we think about preparing for our presentation, first of all, remember every time you do talk to a partner, every little meeting, even if it's about answering some questions on your drug, it's always about selling. Now, the pitch could be for a partnership, it could be a scientific relationship, a collaboration in licensing, out licensing. The goal of any of these meetings, the goal of any pitch is not necessarily to close the deal. The goal is just to get to the next step. So as long as that pitch, that presentation gets you to the next step, mission accomplished. So when you're preparing your slides, keep it simple. And so one thing I'm going to come back to time and time again, keep your materials simple. Use some sort of template if you don't have you're not working for a company. Just try and be consistent. Have your own template that you're constantly using. And this should include a certain layout, certain fonts and color scheme. Now, when you write your bullets, put all your most important information on a slide. Assume that no one's listening. Assume that half the people in the room won't even turn up. I remember back in my days when I was at university, we had maths lectures on 9 o'clock on a Saturday morning. I mean, who goes to a 9 o'clock Saturday morning lecture? Well, the good thing is the lecturer realized that. He realized none of us would come to the lessons. So he would distribute printouts of his slides, and his slides had all the information you needed. He knew that you could pick them up and then not turn up to the Saturday morning lectures and you could still pass your exams. But do put all the key messages on your slides. Try and have on your title, and we'll see some examples of this later. I'll show you some examples of the pitch that we use in ASLAN. On your title, try and make sure that conveys the main message for the whole slide. So if the only thing you read on a slide is the title, at least you'll know what the key message is. And obviously make sure the content is accurate. Nothing worse than seeing a slide with typos in it, because you think if you're that sloppy making a slide, how are you when you're trying to manufacture your drug? So here's a cartoon, little kid holding up his hand saying, "Mr. Osborne, may I be excused? My brain is full." Cartoons work they can work in presentations. When you're using cartoons, or particularly when you're using pictures, do use them. They make a lot of very boring words come to life. When you saw that section on licensing earlier on and all the deal benchmarks, if you hadn't have seen graphs on some of those slides, it would have been a pretty dull presentation. Beware, though, irrelevant cartoons. If you stick in a cartoon that has nothing whatsoever to do with what you're talking about, it may get you a laugh, but it's not going to be very helpful to delivering your message. But some pictures can be quite funny. I mean, I've always loved this one. This is back from my days in AstraZeneca. We have a tumor in the middle, and we have a little kitten with a gun and a little rodent with some other form of weapon trying to destroy the tumor. This is precision medicine, targeted therapy. So when used correctly, these things can be entertaining. They can lighten the mood, particularly in a long presentation. But if you're unsure about it, don't just experiment. Much better if you're unsure just to leave them out and keep it simple. So, animations and transitions, such as the one you just saw, only use them where necessary. If your audience is spending more time looking at how the next slide is going to appear, is it going to fly in from the left, come up from the right, do a little spin before doing a jump, they're not reading your materials, they're not listening to what you're saying. So keep it simple. Avoid too many different fonts, sizes, and styles. Again, you keep it simple. One font, maybe a second font for titles. Use bold for emphasis, but don't go overboard. Be consistent in the use of color. Try and have a color, some sort of color scheme that you constantly stick with. And here's my real bugbear. Never underline things. So underlining was invented back in the days when typewriters first came out, when there was no such thing as bold and no such thing as italics. Back in those days, the only way that you could make emphasis was you typed in the word you want to type, you hit backspace a couple of times, and then you did the underscore character a few times, and then you had an underline. Of course, nowadays we've got bolds, we've got italics, so we actually don't need to underline. If you look at any good magazine or any good newspaper, like a well-written one, you will never see them underline anything. So bear that in mind next time you're tempted to actually draw a line under something. It actually overall takes down the overall level of professionalism of what you're trying to present. Okay, so we're writing our presentation. Our first slide, our title slide, we should mark it confidential if indeed the slides are confidential. We should indicate on that front slide to whom are we presenting. It's always nice when you're presenting to your partner that you say, presentation to AstraZeneca. It makes them feel a bit more personalized. Use a meaningful title. if you've got a long presentation, use a slide in there for contents, just so people know what are the different sections, what's coming up next. And use dividers as you go through the presentation so that people are aware that you've come to the end of one topic and are about to move on to another topic. And always use page numbers. You'll see we've always got on the bottom left there a page number, just in case you need to reference it later on. So here are some examples. This is some examples from our company deck. It's actually a rather old version of our deck, but it hopefully follows most of this advice. This is our title slide. So very simple. Company logo, date, presentation title. This is our next slide. Again, very simple. Everything is one font. Okay, we're using another different font up on the side, but we're very consistent from slide to slide as we do that. The title tells you the key thing you need to know about the company. It's a biotech focused on immuno-oncology and other targeted therapies in Asia prevalent tumors. So even if you don't read anything else on this slide, at least you've gotten away the key message. This is our next slide. Again, title is your key message, focusing on tumor types more prevalent in Asia. And then you can see we sort of just lighten things up a little bit by having a diagram. We don't need a diagram. We could take these countries away and, it says patients in the US, patients in Asia. But just by having a little bit of graphics, it just makes the whole slide look a little bit more appealing and easier to read. And then a slide of our portfolio, again, key title. But again, you'll see very consistent uses of colors. All of these slides are using the same browns, the same fonts. Very simple layout. Everything is neatly aligned. And no underlining, of course. Our team, again, just a very simple layout. And a little bit about where we work. So hopefully that just gives you a sense of how it can look in, at least certainly I'm a bit biased, but what I think would be some well-designed slides. Most importantly, when you look at those slides and you go through those slides, the messages should be conveyed to you effectively. So you've written your slides. Now what are you going to do just before the presentation? Should you practice? Well, yes, I would say you should. But don't over-practice. If you practice a presentation too many times, the next time you deliver it, it's going to sound rehearsed. And no one likes hearing a rehearsed presentation. It should sound, it should sound as if you know what you're going to say next, but it should also have a certain degree of spontaneity, as if you really are having a little bit of discussion, a bit of dialogue, and not just reading from a script. And then on to scripts. So, should you write a script? Well, I would say you should almost never write a script unless you're giving an extremely formal presentation or speech to a group of government ministers, or something where you need to sit behind a lectern like that and read through your script. Otherwise, don't use a script. It doesn't look good when you're reading from a note. It's okay to have some notes on the side which you refer to from time to time, but don't read through your script. The one little admission I will make to all of you is actually when I'm presenting in Chinese, I actually do have to write a script, but that's because my Chinese isn't very good. Getting the timing right, make sure you know roughly how long it's going to take. It's not good to sort of run out of time or take too little time. Printing slides. So a lot of people think, should you print your slides and give them out as handouts to people? Of course, this time, the organizers actually didn't give us any choice. They said, we're going to be printing your slides in a book. But, the good thing is, obviously, you have something to take away, and you can write on it during the presentation. That's great. The thing, personally, I don't like about printing slides is you're already reading what I'm going to say next. You already know what's coming up on the next slide. If I want to have a bit of a surprise, I can't do that because you're just going to look in my book and see what's coming up next. So it's not ideal. The way I personally like to do it is I would give the presentation and you don't have my slides, but then as you leave the auditorium at the end of the lecture, you can pick up hard copies if you want for your reference. At least that way you hopefully get the best of both worlds. Okay, so now we're going to deliver the pitch. So we talked a bit about preparation. And as you prepare, make sure that all your audio equipment is working. Make sure if you're going to use a clip from YouTube that you have an internet connection, and hopefully everything will run smoothly. Next, where do you stand? So some people like to stand on the stage, and they like to stand behind a podium. Now, the problem standing behind a podium is, well, it's good because you have somewhere to put your materials, and you can read your mobile phone messages and no one knows that you're doing it. But it disconnects you a little bit from the audience. And if I'm standing up here, it adds a degree of formality to the way I'm presenting, and it won't allow me to connect with you as easily. It's often good to stand next to your slides. Don't stand in here. A lot of people do it, and they don't realize that they're being spotlit, and of course they don't realize that probably behind them is some big horn coming out back of my head on the slide. But you can stand at the side, and this is good because you can also point on to certain things you're trying to do on the slide. That's fine. Personally, for things like this, I actually like to stand a little bit closer to the audience, to connect with the audience. It's a bit more of an informal presentation. And there's also nothing wrong with moving around a little bit. Don't move around too much. You don't want people to be wondering, okay, so where's he going now? Does he need the toilet? But it just can keep it a little bit more interactive if this person is moving a little bit. Where to look? So you probably know you don't just want to be looking at the slides all the time. As soon as my back is to you, I'm disconnected from the audience. I need to look to you most of the time. Of course, I need to check roughly what's coming up on the slide next. I don't memorize all of these slides. A useful little tip, depending on the setup, is to have your laptop pointing away slightly so the audience can't see it. But if I'm standing here, I can actually just move my eyes over there and see what's coming up next on the slide without having to turn my body around and looking at the screen. So little tips like that just help you to make sure you're looking in the right place. Now, when you are looking, you should try to connect with your audience. Look at your audience. With a big room like this, it's difficult to connect with everybody. But when you're presenting in a small group, I would suggest trying to make eye contact with people. When you're making eye contact with people in an audience, they connect to you. They feel like you're speaking, that they're speaking specifically to you. And that's a very, very powerful technique. Difficult to do in a large group, but very effective if it's less than 15 or 20. What do you do with your hands? Well, the worst thing I always find is when people have lots of change and coins and they just spend all their time playing with it in their pocket. I'm not so rich, $15. But don't distract people with what you're doing. You want people to be focusing on the message, on what you're saying and what's on the slide. So don't distract them by things that you may be doing with your hands. And try, everyone has these little habits that they tend to do that they don't know about. So get your friends to watch you, and it may be something that you're doing with your hands. It may be something about the way you're moving around. It could be anything, little habits. Best to get rid of them. Now, using a pointer, you have to be very careful with these laser pointers. So if you try and, first little pointers, if I try and, let's say I want to highlight this word basics, I've got pretty steady hands. I have not been drinking alcohol, and you can still see that the pointer is sort of not that steady. It's very difficult to hold a pointer steady, and it's distracting. If I spend the whole presentation just, unless you're a cat playing, I've got cats at home and they love these laser pointers. Unless you're a cat, then trying an alternative strategy is to say, okay, first we're going to talk about preparation. This first point here, just circle it and then take it off. This draws people attention to the point, but it doesn't distract them with where the pointer's going next. Personally, I actually don't like using pointers a lot. I tend not to use laser pointers. I prefer to, use my hand, stand next to the screen if I've got a big chart and I'm showing specific things. Mainly because I think if I stand up there and show you things on the slide again, it helps me to connect to the audience a little bit better. Okay, now speaking. Diction, so of course you have to speak clearly. You don't want to get, your words all confused. And for me, my challenge is always the Chinese, because I always get the tones wrong. So my biggest challenge in presenting Chinese, which of course is not a problem for you guys, is getting my tones. But whenever you're speaking, whether it be English, Chinese, or any other language, make sure it's very clear. Your speed, now, you don't want to be too fast, you don't want to be too slow, but also bear in mind that it can be quite effective to somehow change the speed of what you're saying. So I can talk about these points quite quickly, but when I want to stress something, then I'm going to slow right down. And those changes in speed really help you to engage with what I'm saying. Similarly, the tone. Don't just maintain a very monotonous tone. Try and go up and down. Again, it leads to a little bit of interest. Change the, change it up and down. Change the volume. Make people listen to you. And those little tips can be very effective. And pauses. Use pauses. Don't be afraid of pauses. They can be very effective when you're trying to make a point. So connecting with the audience. Always assess the audience's level of attention. Some of these slides that you've seen in this presentation today, we've given a few times before, but every audience reacts differently. And if an audience is getting bored, you have to speed up a bit, you have to brighten it up, you have to wake them up, whatever it might be, hold a break a little bit earlier so they can get their coffee. But constantly watch your audience to see how they're responding. And maybe you're going through some concepts and they're just completely lost. You can notice if people are sort of zoning out or playing with their phones because they don't understand what some of the terms are that you've just used. Humor is a good thing. Tricky to use effectively. So by all means, crack a joke or say something funny, but try and make sure it's reasonably relevant to what you're talking about. I think that the best way to use humor is often at the beginning. Now, you saw Hongren do that this morning. His little example of swimming in the water. I mean, in itself, it wasn't a joke, but it was sort of quite a humorous way of looking at things. And that's very effective because it was very relevant to what we were saying. So think about using humor in a very relevant way to the point you're trying to make. We spoke a little bit about walking around. What to wear? So when you're presenting, I would generally say, the advice is generally it's okay to overdress. You don't want to underdress. If everyone in the audience is in suits and I'm here in, t-shirt and jeans, then it doesn't look very good. Always overdress a little bit. But also bear in mind you're trying to connect with the audience. And so if I come to an academic setting and I'm dressed in my, my three-piece suit with a tie and a little handkerchief or maybe a bow tie, it may look a little bit too much, and you may just view me as this, CEO who doesn't really understand the audience he's talking to. So try and match your dress a little bit to the audience that you're talking to. Of course, if you're Steve Jobs, then you don't have to follow that example and you just wear a black polo neck all the time. Okay, a few other little tips. Presenting without slides. This is really difficult to do. I don't know if any of you have done that, but slides, we get so reliant on them to guide us, to remind us what's coming up next. But it's a very useful skill to have to present without slides. I've sometimes been in some investor meetings, and the investor said, okay, so let's not look at your slides, just take me through the story. You have to be prepared for that. It's not an easy thing to do, but it can be quite powerful with the right in the right audience. Try and make it interactive. Again, a bit more difficult to do with a large group, but you can do things like and please do answer this question. How many of you have actually given a presentation sometime in the last month? Put your hand up. Oh, so quite a lot. Okay. So making it interactive, asking people to think and forcing them to interact is another very good way of engaging. Very good at the beginning, or again, if you see people are falling asleep, another good way to wake them up. Build anticipation. So I love this one. So this is all about in a presentation when you're at the beginning, we tell you what's coming up next, but often there are ways that you can build even more anticipation. For instance, you could say, look, this is the way that we would normally value a company. But there's a much easier way of doing it, but I'm going to show you that at the end. And then suddenly everyone's thinking, okay, so I can't skip out of the lecture early because I want to stick around to the end to watch what that method is. Give people a little bit of, tell people what's going to be coming up next. Make sure people are sort of anticipating something that they want to see. Oops. Okay, so we've gone through some basics of presenting, of how to speak and how to then connect with the audience during the presentation. So now I want to talk about moving on just from presentations to a more interactive way of working, and that's the negotiation. So of course, this will involve presenting, but it also involves a number of other skills as well. Now, negotiations is a huge topic, and we literally have 15 minutes or so to cover this. So we really are just going to be touching on some of the core themes and messages. But I would urge you to, if it's something you're interested in, to try and get more help on how to do this. So lots of different deals we could be doing. Let's assume that you're sitting there with a new technology that you want to partner. Well, where do you start in this process? Well, in all of these processes, we're going to start off by doing a bit of planning, developing our strategy for partnering. Then we're going to find the right partner and start, pitching to those partners. Then we need to execute, negotiate the deal, close the deal, and of course, manage the relationship at the end. So when you think about your partnering strategy, you first of all need to think about what do you need from your partner. We talked about this a little bit at the beginning, but when you are looking for, say, a licensing partner or a scientific collaboration partner, you need to think about what capabilities you need. It might be capital, it might be just a name, a brand name. It would be great to do a deal with BMS. I mean, we've done in our history, ASLAN, about 5 licensing deals. But the one that got most attention was the one we did with BMS. Whether or not that was the best molecule, I don't know, but everyone knows BMS. It's a great brand name to be associated with. You have to think about how you're shaping your deal, and we talked about a lot of this earlier on. But also considering your investors and stakeholders. So, given you're a company that's about to run out of money next year, you need some cash in the short term. Or maybe you've got some investors who are really in it for the long term, in which case that short-term gain in a deal isn't so important. So all of these considerations you need to be thinking right at the very beginning, before you even start talking to your partners or a potential collaborator, in terms of how you want to actually shape that deal. So, let's say for sake of argument, you have found a novel small molecule responsible for blocking a key step in tumor metastasis, the spread of cancer. What partnering strategy are you going to use? Well, first of all, you need to think, well, what do I need from my partner? I've got this great drug, but I'm going to need help developing it in the clinic and manufacturing it. So I want a partner that's got a good track record with oncology drugs, that has no competing programs. If your partner also has a drug that does exactly the same thing, it's going to be tough for them to prioritize resources for your program. How do you want to shape the deal? So again, do we want a big upfront in this deal? Well, it's always good to have some sort of an upfront. One, it's cash coming in through the door, but also it sort of helps to validate that this is a good deal as well. If your partner is willing to put some money on the table. And of course, we need to consider our investors. Let's say that most of our investors are VCs. VCs, typically will have hopefully a longer term horizon. Maybe they're willing to look at this as an investment over the next 6 or 7 years. So, we can think a little bit more about the longer term value of this deal. So to find the right partner, you need to be very proactive. Reach out to the partners based on the criteria you found. Identify the likely partners, prioritize them. It could be a long list, and then start reaching out to the companies directly. Now, this can be tough. If you don't have those relationships yourself, you can attend partnering meetings. You can try and use consultants. You maybe have people in university tech transfer offices that can help. But you need to build these relationships. Deals aren't just done because 2 parties are interested in working together. They do it because a relationship is built. There's a certain amount of trust between the parties, and so then they think that this is the right thing for both parties. Cold calling a company. If you call up AstraZeneca saying, hey, I've got this great molecule, are you interested in licensing it? Typically, it doesn't work so well. Much better to find a way in, find someone, and maybe a friend of a friend of a friend who actually knows someone in AstraZeneca and can introduce you. Consider using a consultant. There are a lot of them around, but make sure they've got good relationships. They're going to be your spokesperson, so you have to make sure that you're happy with them and that they can represent you. And when you work with consultants, try and pay them not with a $200 an hour, but try and give them a contingency. In other words, you will get a big chunk of money, maybe 1%, 2% of the deal, if you can actually successfully close it. That really motivates them to work for you and to get a deal done. And make sure you've got some sort of a process. As those, hopefully, if it's successful, you'll get some proposals in through the door. Make sure you know how you're going to assess them, how you're going to prioritize them. So here's an example from ASLAN. Actually, this is from many years back. Our strategy has evolved a little bit since then. But this is what we were looking for in ASLAN about 5 years ago, 5-6 years ago when we started the company. We were trying to in-license drugs from pharma and biotech companies that were preclinical and phase 1, because any later and they're too expensive, any earlier and it's too far away from market. We were mainly focusing on oncology, respiratory, and inflammation, and targeting Asian and global markets. So this gave us a set of criteria that we could use to hopefully identify some good opportunities. So in this particular example, you've got this molecule. It's involved in tumor metastasis. Maybe you'll go to some of the oncology conferences like ASCO. Maybe you go to Bio or BioAsia or even Bio Taiwan. Try contacting the companies directly. And you're going to be contacting the companies that have big oncology programs like Roche, AstraZeneca, etc. Some of the regional companies, such as the guys in Japan. And there's a number of other smaller companies that may be on your list. And of course, you may use consultants. And maybe that if you're working in an academic setting, that they may come from government agencies. So you spend a bit of time talking to the partners, and then you get into the deal. You need to understand when you're talking to a party what are their needs, and to then start working with various parties to help you with that negotiation. You're going to need a lawyer at some point. And good lawyers will not just tell you how to write a contract. They'll be guiding you on how you capture certain degrees of risk in a contract, how you mitigate against that risk, and how to think strategically. Now, normally when you're negotiating a licensing deal, you'll start off with either a term sheet or a heads of agreement. I wouldn't worry too much about the difference, essentially the same thing. And these lay out at a very high level what are the licensing terms between the two parties. And typically these agreements are not binding. Sometimes you will sign them, but typically there's no need to. And then you start negotiations. Obviously, if it's a very competitive bidding process, that's great for you. Hopefully you can play one party against another, but sometimes there's only one other interested party and it's not quite so competitive. You have to close a deal. Deals don't get done until they're signed. There are thousands of examples where everything looked as if it was going fantastically well and it all fell apart at the last moment. So make sure you have a few backup options, multiple balls in the air. If one fails, at least you've got another option you can pursue. So often the first deal is the most difficult one you can do. You may not have much power. You're a small company or a new academic group. But you do need to understand what it is you can negotiate. You need to understand the value of your technology. You may not have negotiating experience. If that's the case, get help as you negotiate. Often doing your first deal, you're under a lot of pressure to get the deal closed. You just want to get something signed. Again, here it really helps to have a number of different options. So if you're under too much pressure to get a deal closed, hopefully you've got a backup option you can go to. Often you have very high expectations for your first deal, and often these expectations can lead to disappointment. So be realistic. Deals will always take longer. I mean, to do a licensing deal with a biotech company takes about 6 months on average. To do it with big pharma, about 12 months. These are very long processes. And it can get very emotional at times, so you do have to focus on the facts and not the emotions at the moment. Now, a lot of people think that your first deal will define the future direction of your research or your company, but typically it doesn't. It's just the first deal, and there are hopefully many more to come behind it. As ever in negotiations, you have to be aware of cultural differences. And again, if you're negotiating in an area that you've never negotiated in before, then get help. Whether that be I have to say in all of my experience, the biggest challenge I always have is in Japan. Most other parts of the world, I think, are pretty straightforward. But I remember I used to go into meetings in Japan with some colleagues. We've got a colleague in our company who is actually Japanese. And I'll go into a meeting with him, and we'll be negotiating with Takeda, Nippon Sumitomo, and I'll be talking about our molecule, and the other guy will be like shaking his head, and I'll go out of the meeting saying that was a terrible meeting, they're really not interested. And my colleague from Japan will say, no, he really liked it, he's going to want a follow-up meeting. It's Japan I find very, very tough, but there are differences in terms of how people communicate, in terms of the messaging that they use, and you do need to get help sometimes to understand this. Okay, so back to our example. In this case, we've decided that we're going to try and partner this molecule. Let's say we find a partner, and this potential partner has just started to build a new oncology portfolio, looking for new drugs that they want to acquire. Out of 7 partners we're talking to, we end up with 2 that propose some terms to us, and we agree a nice little deal with $2 million up front and $100 million of milestones. Takes us 4 months, we negotiate, we get a deal signed, and during the negotiation we're probably going to be focusing quite a lot on these diligence obligations I mentioned before, making sure this party that is quite new to oncology is going to put the right resources on the project. Now, managing the relationship is key. Just because a deal is signed doesn't mean your work is done. You need a steering team, some sort of group between the companies that can really manage to steer this project. Projects will never go right. Something will always go wrong. And it's really about the relationship between the companies and the steering team that will make sure you can get back on course again. Now, most partnerships end up failing mainly because of distrust and of a falling out. I think it's estimated 75% of licensing deals end up falling apart, mainly because of relationship problems. So final thoughts on the negotiation. Deal making will take a lot longer than you think. Typically, it could be easily 12 months. Don't get greedy. It's actually better to have a strong partner, I would argue, than maybe to have a little bit more cash. Often you could do a deal with a company no one has heard of for a slightly higher number, but sometimes having a good partner will add a lot of credibility to what you're trying to do. Have realistic expectations, understand what the market will pay, and be honest and negotiate with a degree of integrity. You could try and lie and get some short-term gain, but you'll be found out in the long term. And it really is all about a long-term game in biotech. And of course, don't be afraid to ask for help when you need it. So, 2 slides on the actual negotiation itself. Now, normally when we put up these slides, last time we did this, it was actually at TRPMA, we did a little workshop there, and we had a lot more material, so maybe in the future we'll be able to do that again and take you through the workshop. It's fun. It's sort of 2 hours of negotiating on a deal, and it can get quite heated actually, but a lot of fun as well. But in brief, when you're approaching any negotiation, there are 6 key steps. Starts with preparing, understanding what it is you're negotiating, understanding what it's worth. You start a negotiation by building a relationship. You don't jump in with, hey, I've got a great drug. You start off by saying, oh, is this your first time to Taiwan? How was your trip? How do you try and build a relationship. Maybe you meet them for dinner or for lunch the day before in a slightly more informal setting, and you build a relationship without even talking about work. Then you exchange information. You start saying, okay, so this is the drug, this is the information, this is how good it is, this is our clinical data. And then you're going to start getting on to persuading to say, look, if you look at our drug, we've got this great survival data in these patients. If you compare it to some of the competitors, not so good. And you're gradually building the arguments. You'll start making proposals to say, well, look, I think my drug is worth this. You'll have to start making concessions, but hopefully by the end of it, you can reach some form of an agreement. Now, the key principles here is negotiation is about movement. It's about mutual agreement. It's about a win-win solution. If I end up doing a fantastic deal and my partner ends up walking away thinking they've done a bad deal, probably 1-2 years later, the deal is going to come unraveled. Something is going to go horribly wrong. So you want to make sure both parties walk away thinking, they may not have got everything they wanted, but they certainly feel that they've got a good deal and they're glad they're about to sign. A few rules if you start reading the books on the negotiation is you start nice, you be provocable. In other words, if the one party says, well, we're not going to pay any more than $5 million, and then they threaten to walk out, you react to that threat and you say, well, look, I don't think it's helpful right now to be throwing threats around. respond to the threats. Don't just listen to them and accept them. Be forgiving. People can make mistakes during a negotiation. And be consistent. Stick to your guns. Otherwise, people won't believe what you're saying. This just runs through the process that I went through. Preparing for the negotiation, presenting your main rules, making some proposals, doing the bargaining, and then hopefully reaching agreement at the end. One of the best books on negotiation is a book called Getting to Yes. It's a very old book. It's, I think 20, 25 years old. It's been updated, but it's not about drug licensing. It's about negotiations. It's a small book, though. It's about 120 pages, but not very many words on each page. So it's actually a very, very quick read. Read it in about an hour. It's the best thing that you could read to get started with negotiations. And it will cover a lot of the things that we've really just touched on here. And so with that, I know that we've covered a huge amount of material over the last 3 hours. So I'm sort of glad that you have these printouts so you can read through some of it that we may not have had time to cover in detail. But we do have a couple of minutes left for questions. So very happy to take questions either on this section or on anything else that we've covered today. No? Okay, so hopefully we've answered all of your questions. Either we've answered all of your questions or you're a bit too nervous to ask, or either that or you've all fallen asleep, but hopefully not. We'll be at the front for a while now, so if you do have any questions that you'd like to ask us individually, feel free to come to the front. We'll do our best to help. Just to remind you, at ASLAN, we're a biotech. We are formally headquartered in Singapore, but we've got quite a large office here in Taiwan with about 20 people. We are about an IPO on the Taiwan market, so please do wish us luck. But we do like to contribute through events like this. You think that trying to give a little bit back to the ecosystem is very important, because you guys will be the next generation of folks that we are going to be interacting with and hopefully partnering with. So if we can ever be of any help to you in what you're doing, please do feel free to let us know. Thank you.
Yeah, thank you very much for Carl and Zhao's great contribution to this symposium. And let's give another big applause for their contribution then. Thank you. 谢谢。